I wanted to share with you some of the simple ones, which is having enough protein, which means having the ability to break it down your stomach with digestive enzymes, and then having enough amino acids, and then the cofactors. We talked about zinc. We talked about B12. Sorry. And folate. Okay? You need to digest the protein. You need to give him amino acids. We talked about zinc deficiency, and now I want to talk about some of the B vitamins. But again, we need to understand dietary intake varies, and it's critically important that if our patients are on a vegan or plant-based diet, we assess for zinc and B12, because zinc and B12 are most commonly absorbed or available from animal products. And besides causing depression, zinc deficiency contributes to a whole host of other physiological problems. We talked about appetite and enzymes, taste, tension, depression, all related to zinc deficiency. But some of the other cofactors I just briefly want to talk about are the B vitamins. All the B vitamins are critical for memory, cognition, dementia. But the ones that have most research are B12 and folate. And folate, we've got research going back 30 years, hundreds of studies looking at low folate. It's associated with an increased incidence of depression. We have research showing if you have low folate, you don't respond to the antidepressants, very similar to the zinc, and a higher relapse rate. So if you get better on an antidepressant, if you're low in folate, you're much, much more likely to relapse. So folate is really critical. This is a large study looking at low folate correlated with risk of depression, as well as here, the bottom response to treatment. So the relapse rate that I described to you, the difference with low folate was almost half, 44.7%, almost half if you had low folate versus 7.1 in those that are normal. So folate is really important. We also often look at MTHFR, this genetic test looking at variants of how we metabolize folate to L-methylfolate. And if you have that TT variant, a homozygous TT variant, you have twice the risk of getting depression. It's really very common in our research, and it's particularly common in our adolescents that don't get better with a traditional medication approach. So folate is important. And in summary, folate in vitamins are usually synthetic folic acid. Only L-methylfolate can cross the blood-brain barrier and be the cofactor in the synthesis of all the major neurotransmitters. Folate can function as an effective antidepressant alone or with other medications. I want to make sure I talk about vitamin B12, which I feel is one of the significant tragedies of medicine across the globe, not testing for B12 and not aggressively treating B12 deficiency. B12 is critical for neurotransmission and energy metabolism and has critical roles in mental health. You need acid to absorb B12. So again, we're coming back to proper digestion. And again, most bioavailable in animal products. The symptoms of B12 deficiency are varied. Oftentimes, the most common are fatigue and depression. But there are a host of neurological symptoms that we see with B12 deficiency. We could have tremors, weakness, clumsiness, irritability. There's been cases of cognitive decline, dementia, paranoia, mania. So B12 deficiency can masquerade as many neurological and psychiatric problems.